most effective exercise and a stretch that we do with most of our back pain and sciatica patients. So at this time, I'd quickly like to hand it over to Richard. He's going to go over that for you. And then what I'm going to do is talk to you about how we can go about getting a referral, get you signed up for an eval and whatnot. So almost done here. Richard, the floor is yours.
Okay.
Thank you.
All right, I'll need my lovely assistant, Austin, please. So on your back, please. So, like she mentioned, a lot of that cross section, you got your abs, your glutes are one, and then you have your hip flexors and your low back as another group of muscles. So usually the low back and the hip flexors are really tight, and then the glutes and the abs are weak, right? So that'll cause this kind of motion, right? Anyone can relate to that? And then, so what I'll show you is a little ab exercise. So it's called a posterior pelvic tilt. Everyone here can benefit from this exercise. And it's gonna activate the transverse abdominis, which is it's the deepest layer of the abdominals. And it's causing this kind of motion. It's like your girdle. So people who wear those compression things on their stomach, it acts as that. So all he's gonna do is he's gonna feel for that bone right in the front of the hips there. He's just gonna go on the inside of it. And are you there?
I am. Yeah.
Okay, so he's not gonna press too hard, but he's gonna get in there. And then what he's gonna do is tilt his pelvis this way. So tilt it towards it, yeah, just like that. And he's gonna go until his butt just almost leaves the bed. And then he should feel a contraction under his fingers. Are you feeling that contraction?
Mm-hmm. Yep.
Yep. So it may take time to get that kind of motion and get your brain to perceive that you're actually doing that. And then you can actually do this while seated as well. Just sit there with your back against the rest there and just kind of tilt forward and just see if you can get a little bit of contraction there. It may be hard, it may be easy for some. Yep. So it's just that motion. And it would be really helpful for you with that stenosis. Okay, so there's that one. Another one for stenosis, for Karen. Just easy stretch, lying in your bed. Can you bring a knee to your chest, please? Yeah, so this opens up that vertebrae. So it allows less pressure on the nerves. So what you can do is you can kind of go to this shoulder, hold it for like 30 seconds, or if there's pain, relax, but then you can go to the other shoulder. Not too far, but that's gonna just stretch the back, and then when you go to the other shoulder, it's gonna stretch the side of the hip. All right, so that one's an easy one. And now for our herniated disc people, can you flip over to your stomach? Mm-hmm. Just a simple one. On bed is called a prone press up, because this position is called prone. And you're going to push yourself up onto your elbows. Just start with there and then bring yourself up, and you're gonna try and get this extension in the back. And so you go up, you hold it for a second or two, and then back down. And he's breathing as he's doing it. So always focus on breathing. And then the next step you can do, if this is too easy, you can bring your arms forward, and then you're gonna push with straight arms and just try and get more range of motion. This might be too advanced for people, but this is the eventual place you want to be. Yeah.
Is there another position that they can do that in, perhaps standing if they can't get into prone?
Yep.
Okay.
Another one is a wall, we call them wall thrusts, but you step onto the wall, put your hands up, and you just kind of lean your hips into the wall. So, and it's getting the same motion. You're getting that motion, same as when you go onto your elbows. All right.
Cool. Richard, thank you very much.
Yeah.
Great job.
Thanks.